I am Jason Johnson, Associate Chief of Pediatric Cardiology and Director of Cardiac MRI at Le Bonheur Children's Hospital and St. Jude Children's Research Hospital. And it is my distinct pleasure to be joined by Dr. Victor Ferrari, Chair of the Penn Cardiovascular Imaging Council and Professor of Medicine and Radiology at the University of Pennsylvania. He is a true expert in clinical and research CMR. He was the past president of the SCMR in 2015 to 2016 and was the inaugural chair of the International Certification Board of CMR. Dr. Ferrari, welcome.
Thanks for having me, Jason. It's great to be here.
So we are here today to discuss the SCMR 2022 scientific program, specifically the opening plenary session entitled Our 25th Anniversary, Past, Present, Future of SCMR. Now, Dr. Ferrari, I know that you were involved in cardiac MRI even before the SCMR was formed. So when you think about the SCMR over the last 25 years, what's the first thing that comes to mind?
Honestly, Jason, when I look back over that arc of history, it's the lifelong friendships that I've made with my colleagues in SCMR and worldwide. The great thing about SCMR is that it allows us to do things as a group that are greater than any of us could have completed as individuals. And the energy, the excitement, the intellectual curiosity that each of us brings to the table really amplifies that. And an organization is composed of many different groups of people, many different types of people, a lot of different ideas. And an organization can catalyze those interactions between people and also give projects the activation energy they need to get over the hump and to succeed. And when I think of the advances that we've made in the field, many of them have come from interactions between groups of people who come together once a year, and sometimes more than once a year, but particularly for the meeting, and to share ideas, to share excitement, to share disappointments, and to help solve problems. And SCMR as an organization is unique in that it brings together scientists, clinicians, technologists, and a worldwide breadth of experience and interest. And that allows really a lot of very exciting things to happen that might not have been able to succeed previously. So when I think about SCMR, I think about the people that I've met. I think about the friendships that I've made that really have been lifelong friendships. Some of my best friends are SCMR members, and it's allowed me to meet people that I probably wouldn't have met professionally, but who are now some of my closest friends, and they are across the globe. And I really want to thank the original organizers, and I'm fortunate enough to have been there in the early days to watch this recipe being put together and actually succeed. But I really want to thank those people that had the vision early on and the energy to work through a lot of the problems so that we could benefit from the exciting and diverse organization that we have now.
Well, that's very well said, Dr. Ferrari. when I think about my own small time in the SCMR, the friendships that you make around the world are what keeps bringing you back. Now, you mentioned so many different advances that have occurred in the field of CMR over the last 25 years. So what specific techniques have really impacted patient care in that time frame?
Well, I know the speakers in this session are going to really catalog each of those in detail, and I wouldn't want to take a chance at missing something that was really exciting. So I'm going to let them do the drill on each of those techniques. But I have to say, if I look back and I think about personally, the things that changed my career and changed the way that I looked at CMR. One of the first things was Warren Manning's coronary arteries that showed the right coronary artery and the shepherd's crook in the coronary. We had not had a technique prior to that, a non-invasive imaging technique that could image that complex morphology in a way that was non-invasive. And when I saw that, it really sent fireworks through my mind. And I said, this is something that's really fantastic and really is game changing. And so I credit Warren and his early group for putting that all together. I think the other turning points in the field, and again, there are many of them, but the ones that impacted me personally and I think changed my way of thinking were cine imaging. We started in the days when we had the most rudimentary of techniques to try to make single frame images and then stack them together serially to create a cine image. We would set the scanner and then go have dinner and then come back, and hopefully the scanner hadn't crashed and we had something that we could use. But those were the spin echo days that were just torture. But among many investigators who created the new world of cine, Lon Simonetti really changed the world when he created his steady state free precession technique that really changed all of our lives and all of our patients' lives to something that really brought the field to a new level. Obviously, late gadolinium enhancement, Bob Judd and Ray Kim being able to characterize the myocardium for the first time, to be able to look inside the myocardial wall, not just looking at thickening or thinning and other less specific parameters and values for the myocardium, but to be able to assess viability was really extraordinary. Moving a little closer to our era, I think the SCMR registry has also been a game changer. That's something that has really gotten legs and traction and allowed us to, as a society, to analyze data that we couldn't have done without a very expensive, very long prospective study. But to be able to get our arms around some of the questions, particularly ischemic heart disease, using the registry, it has really changed the game. And I think the other techniques and tissue characterization techniques, such as parametric imaging, have also advanced our understanding of the myocardium, what happens to it, how diseased it is in terms of fibrosis, also takes us to another level with non-invasive imaging.
Well, that's an excellent overview of key sequences and techniques that have really impacted patient outcomes over the last 25 years. So switching gears and thinking about the future, so what sequences and techniques do you see impacting patient outcomes in the next 25 years?
Well, I think I'll start with the present just to put things into context. And the major ischemic heart disease trials like CE Mark with John Greenwood, Sven Plein, the MR Inform study, Iconoggle, and again, the work that Raymond Kwong and his group have done with mining the SCMR registry have allowed ischemic heart disease to come front and center with CMR. That is, we are gathering data and evidence in numbers that are respected by other non-invasive imaging groups and other techniques, and allowing us to really advance the field. We're now getting into more guidelines, both in Europe and here in the U.S., and that changes the game when we're impacting patient care and we are represented strongly in the guidelines. But what I see looking ahead, using these data, obviously, and looking ahead, are some really exciting things on the forefront. We've explored some things, at least in our group and others, in high field, looking at 7 Tesla, but low field, I think, is another vista that can be explored, and I think will provide new insights and new directions. Fast stress imaging has got to be front and center. We've got to get imaging done faster, and we've got to do stress imaging, perhaps even without contrast agents, as may be possible, either looking metabolically or at other parameters which have yet to be defined. I think the looking at MR fingerprinting, especially, I think is a game-changing technique. That's going to allow us to gather data quickly and then analyze it after the fact, but not do serial sequences, which obviously takes too much time, but gather one large data set at once, probably rest and stress, and then be able to analyze that data offline, but not keep the patient in the scanner for long periods of time. There are new subspecialty fields like cardio-oncology and others that I think will, again, have a new viewfinder using CMR. So those are some of the things I think that are going to be ahead of us, but obviously many exciting things that we can only even dream about right now. Oh, I should also mention interventional coronary artery disease therapy. I still think we should shed the lead and use the scanner for interventions. I think with enough interest and enough investment in technology, that's realizable. We already can do interventional MR for valvular therapies, and also I think interventional EP ablations and other techniques, mapping, etc., will come into its own in the next 20 years as well.
Well, it surely is an exciting time to be involved in this field of CMR, and I really look forward to seeing if all of those techniques really come to fruition. So how does involvement in the SCMR allow researchers and clinicians to forward the field of CMR?
Jason, that's a great question. And I think the ability to meet people with similar interests who are just as excited and just as crazy as you are with ideas allows that to become the norm. And then it's not moving toward a crazy idea, it's moving towards solutions. So I think having a group of excited, but maybe a little disturbed people as a group, helps you get over that anxiety that maybe what you're thinking about is not doable. But I think the experiences you'll have with meeting mentors, with meeting groups of people that can help you solve a problem, can really accelerate your development as an investigator and as a non-invasive imager. What's especially nice, as I mentioned before, about SCMR is that it's a group of scientists, cardiologists, radiologists, technologists, all patient-focused and advancement-focused. And when you bring that group of people together, when you create that mix of talent and excitement, good things come out of it. And I think the society, and now it's 25th year, and for many of us, many more than 25 years in the field, it's really exciting to see how far CMR has come. And there was a time when we didn't really know that if CMR had any clinical utility, and would it even make a difference. And as you can see, Jason, it's made a tremendous difference for us and for our patients. And so I think the collaborations that we can develop with the society and through the society, networking, mentorship, opportunities, projects, grants, and again, the diversity of individuals is really what makes SCMR unique. And the fact that it's a worldwide organization and touches every corner of the globe also allows us to bring in new ideas, new talent, and always looking for the next horizon.
Well, Dr. Ferrari, I would really like to thank you for your time and your expertise. I encourage everyone to attend the SCMR 2022 scientific program entitled CMR, Improving Cardiovascular Care Around the World. I would encourage you to join the opening plenary session, which is sure to be a highlight of the meeting. Thank you all for your time, and we hope that you are well. Thank you.